Okay, so it's starting to slow down there, so we'll get started. So good morning, everyone, and welcome to our third edition of Small Business Support Series. Thank you for joining us, and thank you to the Department of Labor and Advanced Education for supporting the full week of informative sessions. I'm Chris Mann, Sponsorship Specialist with the Halifax Chamber of Commerce, and your host today. We're hearing from Department of Labor and Advanced Education's Occupational Health and Safety Division for a reflection on how the work of the safety branch evolved in response to COVID and how a new innovative approach to service delivery emerged with greater connection to the needs of small businesses. At a time when small business owners' needs were uncertain and refusal to work was a growing concern, the safety branch and information services line 1-800-9-LABOR became a lifeline for some and continues to provide information and support. Infectious disease is both a public health matter and a workplace safety issue. So feel free to type any questions that you may have for Harold in the chat box, and we'll answer them as time allows. It's now my pleasure to introduce Harold Carroll, Executive Director of Occupational Health and Safety at the Department of Labor and Advanced Education. Welcome, Harold, and I'll kick it over to you to start us off.
Okay, thanks very much, Chris, and I really appreciate the opportunity to present to everyone today and sort of give an update on where we are, where we were, where we are now, and where we sort of see some of our things going. Before I get underway, I'd just like to take the opportunity to let people know that Fred Jefferson is I know on the webinar with myself. He is has been hired as my replacement as I move towards retirement in the coming months. And so Fred joins us from the Fire Marshal's office. And so some of you may have interacted with him in the past, but you'll start to see him showing up with me and then without me over the next few months as he sort of takes over leadership of our team. So I just wanted to highlight that change that's going to come up. So as part of today's discussion and webinar, I just wanted to sort of quickly outline some of the things I'm going to cover off in the slides I have and what I'm going to speak to. I want to remind everyone a little bit of what our role is, how we show up. As Chris mentioned, I want to talk about sort of the COVID aspect, what it's meant in the workplaces and the businesses, how it's sort of changed some things for a variety of people, including ourselves, how it's significantly impacted and changed some of our connections we make through our 1-800 number, but also highlight sort of, what's coming up, how we're changing some of our work, and then sort of close by just sort of highlighting again, how important the relationships are between ourselves and yourselves as part of the small business community. So just a quick overview of what we do. So the Occupational Health and Safety Division, of which I lead, is only one of several divisions within our safety branch. So within the Department of Labor and Advanced Education, the safety branch is a team that deals with workplace safety issues that deal both in the workplace, but we also have our technical safety division that deals with sort of safety in the broader public technical areas. So that's dealing with the elevators, with different types of things like that. So there's in our branch, we deal with almost every business. We deal with all businesses across the province, regardless of size, and we show up in sometimes different ways, depending on whether it's our side of the business, which is about the worker, or whether it's technical safety, which is more about the equipment and some of the technical aspects specific to some businesses. The other piece that comes out, and Chris sort of highlighted it, is that one of the things when it looks at workplaces is thinking about what those hazards are, and it was highlighted with COVID. It was a totally new hazard. And it comes down to we have a role because our legislation does speak to hazards in the workplace and being required to do planning around those. The other thing I think that evolved too for us over the last 7-8 months has been our connectivity and support with the Chief Medical Officer of Health. And under the arrangement we have with them and the orders he has issued, we are actually given the opportunity to enforce those orders. So that's why many of you may have seen our staff out working around what's happening in response to those health orders around social distancing, mask wearing, plans, and a whole bunch of things. So that was a case where our role sort of changed a little bit. So really thinking now of COVID as a unique challenge for us all. You know, as Chris mentioned too, you know, COVID is, you know, it's as an infectious disease, it is a public health matter. You know, and public health deals with sort of the containment, the treatments, and management of that in the greater public good. However, it was very clear that very quickly that COVID is a significant new challenge in all workplaces. And it was something none of us to this extent had dealt with. You know, there was a little bit with the SARS and some of those other types of recent pandemic issues in the past, but COVID sort of crept up, to be honest, on everyone and exploded on the scene. And we had to figure out how we connected from a workplace perspective with the public health side of the thing. And, you know, in our legislation, it does talk about, you know, businesses protecting their employees from hazards. And this was a new emerging issue and hazard, and there was a duty for everyone to sort of look at how they were responding and what that was going to look like. But at the same time, I think our position evolved substantially just to how we were going to be able to support and work with everyone with this sort of unknown virus and what was happening. There was a little bit of carryover from history, but it was a lot of new information coming in, and it was ever evolving, as we all know. So when you look at the COVID in the workplace, as I mentioned, public health has very specific sort of directives around managing the spread, gathering the information, the epidemiology. And as we've seen with the work of Dr. Strang and his office, you know, they have a lot of power to be able to issue orders and directives under the Health Act. And they did, and it was for a specific purpose. But when it comes to the workplace, it was very key that early on we recognized that we're all used to in the workplace thinking about worker to worker, what the activity of the worker is. And so that sort of usually comes naturally for us to think about that. But with COVID, it actually started to expand. It, you know, became critical that people had to think about the worker to client or customer relationship and what that looked like, because there was actually a high risk of exposure both ways. So we were trying to manage not only the worker safety, but the public good. And, you know, because you don't want a worker exposing a client or a customer, and you don't want a customer bringing it into the workplace. But as well, there became a need to look at the customer client to client relationship too, which is, so it all just quickly came together, and we had to look at all the aspects in every workplace. So it wasn't as simple as saying that's public health and that's workplace health and safety. We had to bring that all together. And it was further complicated. Certainly you folks would know as well as anybody that from a business operator's perspective, there was great uncertainty. There was a lot of stake, you know, whether the business was closing, some closed, some didn't. And then it got even more ramped up as we moved through that reopening process in May, June, and July, and figuring out what the rules of the game were for everyone. From our perspective, one of the unknowns that sort of emerged quickly for us too was the mental health in the workplace, and we heard a lot about the fear of going back to work. You know, we got lots of calls to our lines with people asking questions. You know, they're scared to go back to work because they're trying to understand what the risks were. But then at the same time, we had some operators and businesses that were trying to understand what the work refusal process looked like, because their expectation was that they may be inundated by work refusals. And so we evolved how we were responding. We built up information to help us get there, and tried to be, as Chris had mentioned, we really took an active role to provide real-time responses, quick responses, And we've moved from, on average, maybe 20, 30 calls a day to several hundred to our 1-800 number. And during a period of time, and normally we get 200, we were getting 2,000. So, that was extremely challenging for us, knowing we only had one operator at 1-800 number. So we had to ramp up and find new ways to do things there. The other key thing that came out of all this that I wanted to highlight too is when it comes to managing something like COVID, and it really got emphasized during the last several months was, and you'll see it in our legislation, and it's something we hope all workplaces are actively doing, is really thinking about what are their hazards in the workplace. And I think COVID highlighted how this process can work to the benefit of the workers and the employers and everybody else. And so I think up until now, this has sometimes been a challenge for many people to sort of put through a process in their mind. So if you think of the COVID piece and how work businesses and flows and things have changed, and you look at this triangle of sort of how you try and eliminate hazards and risks, we've worked through all that. We went from trying to remove some of the risk by having people work remotely. We could not replace the hazard with something a little less hazardous just because of the nature of what we were dealing with. But, we talked about, okay, if you can't remove people from the situation through remote working, then we looked at, well, can you put up barriers? And so that happened first and foremost in a lot of the retail sectors, putting up the physical barriers. Then you look at administrative controls and modifying how people work. And so that's the no-touch pay. That's some of the other things that were introduced, even one-way traffic flow. All those things are part of this hazard process. And at the very bottom of the pyramid, and the last thing you always want to do is introduce the need for personal protective equipment. What we did see early on in the COVID was people wanting to jump to the last measure first. People wanted to implement personal protective equipment. And in the occupational health and safety world, when we talk that, we're not talking the masks that we're wearing. We're really talking N95 masks, which are respirator type masks that have very strict standards and controls on them. But it's just, the key thing I want to mention though is that we've worked through this pyramid provincially with the sectors, with everyone, in building all the compliance guidance documents that people have been working from. And as I mentioned, we received an exorbitant number of calls to our 1-800 number, and I think it was largely because there was no place, people didn't know where to go. And that was one of the challenges early on, is how do we get information out? So we became a conduit for anyone to get information, and whether it was a workplace safety question or not, it didn't matter. We tried to make sure we were connecting with the right people and getting that information back as best we could. But it did highlight that, we were able then to use that service to also help people to push out information. So we were looking at informing people of what they needed in their prevention plans, which we helped review and support the public health folks on building those guidance documents. We made it, we were out there helping people understand what they needed to do at their own workplace, which was, building that prevention plan template and what that looked like, because people knew they had to do something, but they didn't know what they had to do. And then once they figured out what they had to do, they weren't sure how to communicate it or document it. So we kept building more supports as we went through. And we also took on a role to help people understand what the public health orders were saying, because, unfortunately, when we issue orders like that, they have to be in certain format from a legal perspective, but sometimes that's not easily transferable to what I call plain language. So some of our role was through a 1-800 number, helping people understand what the expectations were. And so we took a very active role in that. And I would say the other thing that we've done is we've expanded connections to other government departments. We've connected with all the industry sectors, and we used some relationships we already had, and we took advantage and built new ones. And, you know, when we think about relationships from our perspective of occupational health and safety, it's a critical piece of, of how we work. We need to be able to connect with the businesses that are trying to work safely and those that are not, so that we can give them information. But we also want to make sure that businesses and operators feel comfortable in calling us with questions. We're not about getting a call and jumping on into the vehicle and going out and finding what's wrong. We want to help people be compliant. We want to help people work safe. And so I think over the COVID stuff, one thing that's happened is that we developed some new relationships, like I mentioned. And at the same time, we've made many people realize we're not just a complaint line, we're also a source of information. And we can help people. We can help guide people sometimes to other places that are going to support them, especially the connections we have with sector councils and safety associations that have some great resources out there for people that may be struggling. And for those that may not be part of them, it may help us identify a gap that we can fill in ourselves and help get information too. But we all share the same thing. It's all about doing the right thing. And it's all about trying to make sure people are safe. And I think we've proven in Nova Scotia that the model we've used, knock on wood, you know, we've done very well in managing COVID exposure and risk. And while it's not back anywhere near what it was pre-COVID, we have done very well at managing that balance between safety, public health, and the economic and business communities. And I mentioned, you know, we've sort of changed our service delivery, has sort of evolved a little bit over time through this. You know, we've changed who we're connected to. We've connected with some businesses we haven't talked to in years, especially on the retail sector side and restaurant side, and even other type of businesses that traditionally we've never met with. And we've met with them about COVID. As a result of that, we're getting actually people wanting us to come back and have a chat more broadly about safety in those workplaces. We've realized as well that, you know, we needed to modify how we were delivering some of our services and doing our inspections. And so we have looked at doing virtual inspections where it makes sense. But at the same time, we've taken advantage of this tool, just the webinar and the ability to do things virtually now. We have had, you know, we're now doing engagement sessions using virtual tools, which actually gives it a greater reach than the traditional come to a meeting at this hotel or this venue, because that sometimes can be challenging. You know, we, rather than just focus on OH&S, which, you know, we took our skill set of being able to analyze and look at things and actually help public health build stronger guidance plans. We became a very active challenge and review group for public health when we were trying to build the guidance plans for all the different sectors. You know, we would bring in questions that from a workplace, but it wasn't just that workplace scenario was transferable to all kinds of other things. So that's why, you know, we moved into looking at not only how the workers interact, okay, well, how are you interacting with the customer? How are the customers interacting? Because it's all part of the same hazard matrix. You know, we did many spot checks around issues and still do to this day. You know, we've built a collaborative inspection team within not just our staff, but using folks from Nova Scotia Environment that have a experience in doing inspections like us, as well as alcohol and gaming. So we've actually built a stronger inspectorate team within government, because now all the parties are getting together and they're actually talking about issues together and throwing out new ideas and information that, you know, I think is improving that. And as I mentioned before, I think the whole idea of the hazard assessment and the use of controls is new, and it's been highlighted. I shouldn't say it's not new, but it came out as a key lesson learned, and more people realize. And as well, we've upped our communication tools, and not only for our 1-800 number staff, but we've built new information tools that we're using to push information out through social media and other venues. And, you know, I can't go by without talking about sort of the COVID prevention plan. So, you know, that was really a key thing to build that, because it actually provided help in and allowing people to start thinking about what happens in their workplace, how their workflows are, where those risks were, and what they could do. And it was important because it also became a communication tool with their staff and employees, but it also built confidence in clients and customers knowing that workplaces were doing something. And that comes back to some of the questions that we saw early on around the fear and how people were going to start getting back. And I think you just see, you know, there's still some anxiety. We know that that's out there amongst everybody. That's I think, going to be with us for a bit, but people have stepped up, and the prevention plan was one of those tools. But there's also lots of other best practices that people have implemented individually that I think are going to remain. And we're already seeing that from some stakeholders we deal with. Some people like the idea now that you got to make it, you know, the use of appointments is probably the biggest one. Some businesses are not going to return to the drop-in because it gives them more management control by having appointments. The use of touchless pay mechanisms has gone up because you got to think, even when we get COVID under control and managed, infectious disease is not just COVID, it's the flu, it's all kinds of other things that already exist. So I think it actually has opened up the door for better overall management and thinking around general transmission of illness within our workplaces and our communities. And I think it's important to sort of keep that in the back of the mind, because we've implemented all kinds of new best practices that really should stay beyond COVID. For us, really, we're going to continue to build tools and additional supports. We've been very fortunate to be involved with this during the last several months and continue to participate up until it's under control, but we've built new connections with public health, and we're actually ramping up some of our own resources internally to better work on that healthcare and the health aspect of occupational health. That's a gap we've identified. We've introduced a new tool called Safety Notifications, which is different ways to message out to people some of the issues and challenges that emerge and get information in the hands of people in a more timely fashion. So you will see bulletins from us periodically. And as I mentioned, we're trying to do more with the social media and have greatly enhanced our access and use of 1-800 number. And it can't go by certainly without acknowledging that none of our work would be successful unless everyone chipped in. And you know, you often hear a lot about the big box stores and the big players and everything, but we know just from our work that small businesses are crucial and are an area that we need to connect with. And so I want to thank everyone for their participation. They're doing the best they can for reaching out and hopefully continuing to reach out to us if they need help and information, because that's what we're trying to do. So we want, you know, please call us. Our 1-800 number is there. We're in the midst right now of finalizing a new campaign over the next year that's going to highlight our 1-800 number. Again, the key thing is we want to make it not a complaint line, which everyone has used it at effectively. It's really more than just about the complaints. We want it to be an access of information, a way for people to access information. And like I mentioned, we value the new relationships and connections we've made at the field level, as well as within the sectors, and we hope to build on those going forward. And so with that, I'll just close it off and open it up for any questions.
Great. Thank you so much, Harold. That was a lot of great information on there. And it's just amazing how LAEs has been able to kind of, as you mentioned a couple times, evolve. And the fact that the silver lining from all of this, I think, is, you know, obviously the resources that are out there and what people are learning and how they can put that into their business. But I mean, the virtual aspect, being able to engage businesses from a virtual aspect. I mean, that's something for us that was always something that we had there, but we didn't really always offer. And that's something that we do now all the time. So anything that we do now always will have this virtual aspect. So a lot of great stuff on there. And I mean, I'll hit it home as much as I can, that 1-800-9-LABOR line. it's on everything that you promoted on all your slides. So it's awesome. And for our listeners and our viewers, is to really get out. It's a source of information. I think that's really important. So just a couple of questions here, and I encourage anyone that's watching to please feel free to add any questions that you may have in the Q&A box below. We talked or you mentioned a lot about the biggest concerns, that people had when COVID first broke out, and what businesses were doing. What would you say right now that we've evolved through COVID a little bit more, what do you think the biggest concern for businesses is right now with COVID?
Well, I think sort of what I'm seeing is a lot of the challenges around still trying to think of how to go back to what it was pre-COVID. And so we are, we see a lot of the requests because we're still, intimately connected to public health when information and stuff comes into them. But people are still trying to move back right now to what it was like pre-pandemic, as opposed to still staying the course, being deliberate. I will say that a lot of businesses are still trying to expand their services while keeping in mind the COVID requirements. But I know there's a lot of pressure depending on the sector, dealing with customers, that some people are wanting, again, they want some of the norms back. And I think the biggest thing is business really are struggling as to how to find that balance to keep the COVID at bay, to not expose anybody unnecessarily, and allow a little more normality, I guess, into the business or the operation. And I think that's still the challenge. And I think, to be honest, put the faith in, at this point, in public health, that everybody knows that that's where people are looking to go, and that they are trying to think about how that can happen while still respecting the risk we still have with COVID. Because COVID, I mean, we're fortunate that we're not getting those exposures, but the last few days we've seen increased counts in Nova Scotia because of travel piece. And so public health is still mindful of how do we let people do more, but still keep that control. And if you think about, what we've worked with and the supports to get some of, the hockey has returned with some restrictions. There's some more events starting to happen. But they're organized differently. And I think that's the biggest thing, is it is possible to do some things, but you're going to have to really think about how it's organized and managed differently. And if you don't want to do the management in that differently, I think you may be challenged in being successful, because I know anecdotally from discussions, when Ontario had that recent spike, or started the sort of second wave or third wave with them, one of the areas of issue was in their restaurant and bar sector. And we weren't seeing it in Nova Scotia, even though we had some very similar type of guidance. We had in-seat service only. They didn't have that restriction. So even though they may have limited the number of people, they were still getting all that intermixing and social activities amongst a whole bunch of different people. And so I know from my discussions with my counterparts, that seems to have been one of the key differences for us. So that's what I mean. I think we just have to be very deliberate as we continue to provide more offerings.
Right. No, that's great. And I think one of the biggest, or the best slide that you had in your presentation was that inverted pyramid. Because I think a lot of people, when everything was going on, it was immediately rushing to PPE, as you mentioned, and all the steps that you had in that inverted pyramid. I think if people took that, and they are, and taking it very seriously, if they follow those steps, then the PPE, to your point, and then in that pyramid should be the last resort kind of thing, right? Yeah. Out of all of this, and you mentioned about the amount of sectors that are kind of popping up that you haven't heard from in quite some time, which business sector are you hearing from the most, and which one maybe are you not hearing from that you'd like to hear from?
Well, I'd say the ones that we've sort of that the connections have expanded and has been retail for sure. But the one that well, we've always had a bit of presence in the retail, but not to the extent we should have. So that's expanded.
Great.
The one where we had limited connection was really the restaurant sector.
Okay.
And so as a result of COVID, we were doing spot checks, and that's the one where many of our staff that have done those checks have said they've had those facilities reach back to them asking for them to come back and have chats. So that's the one where we've seen new opportunities. I think there's some other ones too, is around the events. That is an area we've not been engaged with, to be honest.
Okay.
So as a result of all the support, again, we've done in helping build the guidance documents, we've connected with some of the major event organizers in the province, have been engaged with some of those ones that host major events. And so that's an area where now we have connections, and we can actually go in after all this and help them maybe look at their own as a workplace, because even event holders are a workplace because they employ sometimes several hundred staff for short-term events.
Right.
So that's a new one. I think it's maybe always been in the background, but it's really a new opportunity for us.
Great. Okay. And I think, I mean, with us, we're doing events and we're getting back to it, in-person events. And, the team here has done a fabulous job of ensuring that we're following all the guidelines and protocols. But through these kind of relationships that we've had with you guys doing the webinars and what have you, I think, it's nice to have that connection and to reach out to you when we have a question, or if there's a new protocol that we're not quite clear on, to reach out and get some information, which is great. You mentioned about like businesses reaching out. How often do you think businesses should be kind of following up with you to come in and maybe do a safety update or kind of briefing in their locations?
Yeah, well, I mean, it's, for the most part, businesses, if they don't have any sort of safety protocols or plans in place, those are the ones that'd be good if they sort of reach out now, and just because we want to try and help them understand what they need to get. Once they've got the plan in, then it's just a matter that if there is a significant change in their operation, maybe they give us a call. But we are not, I want to emphasize this, while we are the regulators, so we really can't be doing safety audits for individuals. Sometimes people think that that's where our inspection is. Well, no, it's not. So that's why, we want to really try and help people through the 1-800 number. But, if people are really questioning and not sure if they're on the right track because of what their business is, and it's offering or using different type of equipment and things like that, or they're not, give us a call, and we may be able to either provide you information over the phone. And if it's something totally new, and bringing in new equipment, especially, and things like that, there may be issues with that equipment that you're not thinking about, and things like that. But so all you can do is call the number. If you have a question, call us, and then based upon what the question is, it can either be answered right away through the 1-800 number, or it does get deferred to an officer, and we respond to every call. And like I say, some of them get some of them get a visit. Some of them would be answered over the phone, because anything that we get a lot of calls on, we have a pretty strong response system already in place and know what the answers are. Anything that's a little more random and uncommon would maybe get deferred to an officer. And if it's, and depending on what it has to do with too, the severity of the potential injury and things like that, dictates some of what our response looks like too.
Right. Okay, great. And, just thinking about, how great Nova Scotia has been kind of leading the country in terms of what we've been doing to kind of keep COVID at bay, which is fantastic. If there was another spike and we entered, per se, a second wave here in this province, how can we avoid possibly a shortage of PPE? Now, I know we talked about the inverted pyramid and all the steps there, but is there any other way that we could really avoid, people maybe going out and taking away too much PPE from other companies, if that makes sense?
Yeah, well, I think, provincially, and again, I can't speak for us because our role is not in that supply chain, but I know the government, has taken steps to try and work with federal agencies as well on securing the procurement. And I know from our role is that and when I say PPE, I talk about those that are standard, like I'll use the N95 mask, for example, which is it's a certified mask, whereas the non-medical masks are not. So if you think about the PPE from the certification side, for us, we do and are able to, for example, recognize alternate standards that conform to an equivalent of an N95. So sometimes it can be that there can be alternate suppliers access. But I know federally and provincially governments I think, have ramped up their supply chains, that those that need the certified protection, public personal protective equipment, like the N95 masks, are probably going to be reasonably okay. And with the way public health has provided direction on just general mask wearing, is, like say, that's the most critical thing we all can do, and that's not relied upon the more formal standards. So, so I don't think that we'll see the same challenge we had before. The same with, some of the other equipment that was, being used. People have tried to manage that better.
Okay, great. So, Harold, I'm just seeing if there's any other questions here in the Q&A box. So I'll just kind of wrap up here, but if there is a question, please send that through. One thing that you mentioned just before you close out your presentation, you mentioned about how your department has evolved in getting into social media quite a bit. One thing that I would encourage you and your team to do as well is please keep in mind tagging the chamber in anything that you're doing, because that's something you mentioned. Small businesses are the ones to worry about as well, outside of the big box stores. But our membership is mainly made up of small businesses, so that's something that we can promote on your behalf if you tag us, and we like it and we share it. So please keep that in mind. Just before we joined the webinar, you mentioned that you're retiring, so I'll send you off on a happy voyage on your retirement. I know it's a couple months down the road, but thank you for everything that you've done, and we appreciate you doing this webinar today. And also, you mentioned Fred Jeffries, who's on this call, or Jeffers, sorry, who's on this call. We'll get his contact information from you, and we'll be reaching out to all of our participants on this call to provide that contact information if Jeff's okay to do that. I'm not sure, he might be, I don't know, we'll see. But did you have any last points before we close everything off today?
No, I think I'll just reiterate sort of the messaging we all hear from Dr. Strang on the COVID file, that it's about sort of maintaining our diligence over the next number of months. And I think from a workplace perspective, it's don't lose sight that even though we're doing well, it's always a risk in the back of our mind, and be intentional about any decisions to add more things and think about how it works. And I guess I just want to say thank you to the Chamber, because we appreciate, the opportunity to connect, because we do, like I say, we know we need to connect better with the small businesses, and that's why we look forward to these opportunities, because it's a way for us to connect with those small operators throughout the province, and including Halifax, obviously. But it is an area that we're trying to put a focus on to better connect.
Amazing. Well, we value your partnership as well. So anything we can do to help, absolutely, we'll do that. So thank you very much, Harold, for your time today. And, sadly, we'll have to cut you off here. But thank you to everyone for attending today's Small Business Support Series. We have one more day of the Small Business Support Series. We're discussing labor standards tomorrow, so please join in. So we'll see you next time, and have a great day to everyone, and enjoy the rest of your week. Take care.